how to care for a patient with a tracheostomy. Specifically, care for a patient with a non-disposable inner cannula, stoma care, and then changing trach ties. I will first describe the necessary supplies that you need to gather. There are a few options that you might see in different institutions that you visit. We have a smaller tracheostomy care kit that simply has 4x4 gauze and the necessary supplies to clean an inner cannula, which is used often best for simple stoma care. You also have a larger tracheostomy care kit, which has all the necessary supplies, including the solutions that you will need for this procedure, such as hydrogen peroxide and normal saline. If you are to use the smaller care kit, you will also want to grab from your utility closet hydrogen peroxide and normal saline. Always have necessary supplies to wash your hands, and we also recommend that you gather a second set of sterile gloves, just in case you soil your first set. Other necessary supplies that we would also recommend are a second set of trach ties, and we are using the Velcro kind because they are the easiest to use. And you will also want a towel, and that's just to cover your patient to prevent them from being soiled during this procedure. Now that you have gathered your necessary supplies, you should go in and assess your patient. First, always identify your patient. You need to remember that patients that have a tracheostomy may not communicate in the same way as we do. So always remember to identify the patient using their medical band, but also verify that with the documentation in their medical record. You can also have them write their name or say their first and last name and have them nod their head. So I will identify my patient. Hello, Mr. Smith. Can you state your name and date of birth for me? And it will go as follows. Next, you will assess your patient. It is very important to assess the lung sounds and the oxygen status of your patient. So you can always first use your oximeter, your pulse oximeter, to assess the patient's oxygen saturation. And you want their saturation to be above 92%, or you will be required to hyperoxygenate them before the procedure. Also, you will want to listen to anterior and posterior lung sounds. Now that you have completed the assessment, you will know whether you need to suction your patient. If you do not need to suction your patient, you can then begin trach care, and that is what we will do now. The first step that you will want to do is don non-sterile gloves. And you will have your non-sterile gloves on to remove the 4x4 split gauze, which can be disposed of in the trash can. You will then wash your hands. After washing your hands, you can place a towel over the patient's chest just to prevent soiling their gown. You are now ready to set up your sterile field. You set up your sterile field by opening your trach care kit away from your body. And sometimes it's easiest just to remove the flap altogether. You can then remove your sterile gloves from the package and the sterile drape. You can touch the outer 1-inch border of the sterile drape. The plastic side is down on your bedside table. Now you can don your sterile gloves. Remembering to place the first, or to don your dominant hand first. Now that your hands are sterile, they must be kept above your waist. And you are now prepared to remove the contents of your sterile basin and place them on your sterile field. Within your sterile basin, you will find a 4x4 split gauze, site. It is my recommendation to kind of pull them apart from the package so that it's easier to grab a hold of each. There's also trach ties in this kit which can be disposed of because we will be using Velcro ties. You will also want to remove your sterile saline, your hydrogen peroxide, and you can dispose of the second set of hydrogen peroxide, and you also have some cleaning devices. You have a pipe cleaner as well as two cotton tip applicators. You are now prepared to fill your basin. And you do this by opening the sterile saline and filling 1/2 inch to an inch full of sterile water in each compartment. And then you can dispose of the container. You will then open your hydrogen peroxide and pour into the largest basin, making a 1/2 and 1/2 mixture to clean the inner cannula. You are now ready to remove the inner cannula, and you do this with your non-dominant hands. You do this in a counterclockwise fashion. The non-disposable inner cannula will click out of place and can be removed. You will then hold only to the top portion of the inner cannula and place in the 1/2 and 1/2 mixture. You can use your pipe cleaner to clean the inside first and then the outside of the inner cannula. You can now dispose of your pipe cleaner. Hydrogen peroxide can be very irritating to the skin, and thus the inner cannula should be agitated in the just normal saline. You are now ready to reinsert the inner cannula. The water will act, or the sterile saline will act as a lubricant. You do this in a counterclockwise fashion until there is a clicking sound. This procedure now becomes is no longer sterile but a clean technique, and you are going to finish by completing stoma care. My recommendation is still your right hand is more sterile than your left, and you can gather in the four corners your sterile gauze, which is then dipped into the normal saline. You can wring it out to prevent excess moisture, and you are going to clean around the stoma site from clean to dirty, so from in to out. And you repeat this step by wringing out the 4x4 gauze until the stoma site is free of any gunk. The last thing that you can do is then clean the actual phalanges around the stoma site. And we recommend that you save one 4x4 gauze to simply dry off and around the stoma site. And lastly, if there are still little pieces of gunk, you can dip in the sterile water and clean closer to the stoma site. Now you're ready to reapply the 4x4 split gauze. And you can do this. This is no longer, of course, a sterile procedure, so you do this by simply sliding 4x4 gauze underneath the phalanges, trying to maintain patient comfort. And pulling up around. This is just to protect the stoma site and to soak up any extra secretions. And that is how you complete stoma care. You can now remove your sterile gloves and wash your hands. Now that we have completed tracheostomy care for this patient, you will need a second assistive personnel to change the trach ties. It is our recommendation to change them every 24 hours or when soiled. For this procedure, it is not sterile, so you can don clean gloves. Amber, will you please come and assist me in changing the trach ties?
Yes, Erica.
Okay. Amber, my assistive personnel, will hold the phalanges of the trach tube, and this is stabilize it so that when I'm removing the trach ties, there is no chance of decannulization of this patient. So only remove one side at a time. I removed the old trach ties, the Velcro trach ties, and am reinserting a new tie. You will pull this behind the patient's neck, the new set, and then remove the other side. Whoa. You tighten the trach ties so that there is 1 finger breadth on both sides so as not to cut off the patient's circulation. You can now remove the old trach tie and dispose. And that finalizes this procedure.